up just a little bit, we'll be able to see the whole table. Eh, yes, exactly, that table. And so basically, we have talked about and shared maps for Charleston, for the city of Charleston and Charleston County, which, although that data currently is dated, is quite a few years old, it shows many similarities to this comparison of Beaufort and Dillon, and how different two states, which are relatively close to each other, both in South Carolina, can look so different as far as health indicators. And I think that's sort of my take on this health improvement plan, is that we don't we would certainly like to provide all services to all peoples, all counties, all communities. But when we see these sorts of disparities, to me, that speaks to a need for directing resources differentially, depending on what our community's needs are. And so these are just some of the data that this report discusses. Much of the data in this report is not broken down by county. Much of it is statewide data, although some of it is. But this just shows that we, the Department of Public Health, are able to sort of pull and analyze this data on a county level. And so I hope one of the takeaways today is looking at the state plan and thinking about, our community, our city, and how we might come back to the Department of Public Health asking for data that is specific to Charleston, and how we can start to think about our own priorities within this state. And in fact, I do want to mention that our Healthy Tri-County has also done similar health improvement plans. There's not a new one yet, but they did a very good job on the last one, bringing together many partners, and we're hopeful that that process will get started again soon for the next 5-year cycle. And that really looks at that's a partnership with MUSC. Roper St. Francis, Trident United Way, Department of Public Health, I think Trident Medical Center. Lamar maybe can help me with some of the other partners. But that's a process that's more local. But of course, this committee is even, more local than that. So that's basically a little bit of sort of putting this into context. And so, the reason that these health improvement plans are done on the state or local level is really to talk about using data to track progress, guide improvements, and refine strategies over time. And as this sort of paragraph just to the right of the table says, this was developed through Live Healthy South Carolina. And that's a partnership with the South Carolina Department of Public Health and the Alliance for a Healthier South Carolina. But many partners were at the table, other state agencies, healthcare providers, policymakers, community organizations, all with the goal of collective action is how we're going to be able to move the needle on many of these data points. And so priority areas were informed by a state health assessment. That is also has been done by Healthy Tri-County in the past for the Tri-County area, a health assessment. And then these priority areas were shaped through engagement with partners and subject matter experts across the state. So really, the goal of this plan is actionable strategies to align resources, guide decision-making, foster collaboration, and track measurable progress in population health. And I think that's really, in many ways, the mission of this this committee as well. So let's see. If you want to move to page 12, Councilman Shealy, I think, yep, go back to page 12. This is just talking about sort of how the I think this is, sorry, I didn't mean that page 12 in the top left corner. So this is just yes, exactly. Thank you. So this is a little bit of just the framework. So basically use both the population health model and results-based accountability, which is really a data-informed methodology for being able to understand priorities and then track progress over time. And so the population health model really looks at both health outcomes and health factors. So outcomes are the results we aim to improve, and factors are the conditions that influence those outcomes. And results-based accountability, as you see here with the 3 questions, really look at asking the question, how much did we do? How well did we do it? And is anyone better off? So it's setting priorities, and then it's saying, you know, did we meet those? How do we come to understand that, the progress that we've made? And so there's both population accountability, which is collective responsibility requiring broad community engagement, sort of all working together. And then there's performance accountability, where each organization focuses on their effectiveness and efficiency in working collectively towards these goals. So basically, this health improvement plan talks about 9 priority areas. Those are the colored boxes on the right there. So the 2 health outcomes are quality of life and length of life. And then the priorities fall from those. For quality of life, chronic health conditions and behavioral health were the 2 priority areas pulled from quality of life. Length of life, maternal and infant health. And then looked at health factors, including health behaviors, clinical care, social and economic factors, and physical environment. And under those, with health behaviors, affordable and nutritious foods, and safe and affordable places to be physically active. 2 priority areas this committee talks about frequently, including last month. Clinical care priority area is access to high quality health care. Social and economic factors, income and poverty and education, and finally physical environment, and the priority areas neighborhood and community development. And of course, these aren't all the priority areas that are possible, but through this process, these are the 9 priority areas that for 2025 to 2030, the State Health Improvement Plan chose to concentrate on or focus on. And so maybe let's go to page 18, and I'll just show sort of as one priority area, then how this is broken down. Go the other way, I think. Yes, right. Yeah, exactly. So every priority area has sort of 2 to 3 pages that look like this. So it presents the priority area, like here, chronic health conditions. Move down just a little bit. It then pulls out several health headline indicators. So these are indicators that we in South Carolina needed access to data around. And so they might not be the indicators that in a perfect world we may choose, but these are ones that we have good data to support. And then strategies were developed. And these are very specific strategies to address chronic health conditions. And then we can use these indicators again to sort of measure progress. And move back up just a little bit. If we look at the map, this is one where we do actually have data on every county in South Carolina in this plan. And so we can actually see a third of all adults in South Carolina have multiple chronic conditions, and it shows by county and by shading which counties have the most what we call disease burden for chronic conditions. And so, and then if you just go to the next page. Again, there's data for those headline indicators, diabetes and social vulnerability. And then the strategies are laid out with some specific action items. And so I think I'll stop there. Paul did shared this document. And so this same sort of way of presenting the priority area, the indicators, and the strategies is repeated for all of the 9 priority areas. And then at the end, Councilman Shealy, I think it's all the way to page 68. The last page before the appendices just briefly touches on turning strategy into action. And so this really talks about key implementation focus areas and an overview on implementation. So how can this be put into action? And so we just wanted to, I know this in the beginning of the year, but right as we begin 2026, we just thought that we might use this as a foundation for having a discussion about priorities for this group, about this obviously this is, as you'll see in the appendices, it's much work by many partners. So I don't know that we will do this exactly for the city of Charleston, but I do think that it can be a springboard for thinking about what priorities we would like to discuss, to work on in the coming year. And I'll turn it over to Paul to say a few words, and then maybe Lamar would like to say some thoughts on this, and then we'd like to open it up to the committee in general. So Paul, I'll give it to you.
Can you hear me?
You can hear you
Yes.
clearly. Good job. Yeah.
I'm running all over the place because something hit my computer this morning and just wiped it, sort of like killed it. So I'm in the car trying to have a conversation without my notes in front of me. But I did notice in the plan, and I think it was a good point to do, that it lists the different levels of how this plan was put together. And the last one was where it was all about collaboration, where we own what we need to do in our community and help make the difference statewide by what we do locally. A lot of our numbers are in the lower end of the better, healthier end of what some of the parts of our state are not. But I still think if we could just take some of that, which we've done over the last couple of years, we've had our meetings centered around what was in the local CHIP plan, or our own improvement plan for the Tri-County area. And we've looked at transportation, we've looked at access to care, we've looked at food insecurity, but I think we need to just continue to stay vigilant on those items and get a little deeper into the roots of find out where those areas are. So we could, I just think it's a good way to remind ourselves that our mission is not done yet. We've got a lot of work yet to do in our community, from mental behavioral health to the food insecurity that Nick is working so hard with, and to the physical activity that we heard from the school district over what was going on. So I just think this it's a good time, good spark here to just help us reunite for what we're going to look for in the coming year. So I look forward to maybe we set our agenda, either we could start some today, but January we set an agenda to look a little bit deeper into Charleston's numbers. And I could get somebody from our planning division to see if they could attend our January meeting to specifically talk about the health plan and how, I mean, the Charleston regional planning device that is used where health got injected with health and all policies as a basis for trying to improve the health in our planning. So I can ask to see if they could join us either January or February, but I just think we need to really be a little bit more targeted or focused on some of those items that are highest in our low country.
Lamar, would you like to say a few words about the health improvement plan and the process?
Yes, ma'am. Good morning, everyone. Thank you, Dr. Richardson. And just just for the opportunity to be here this morning. And of course, it's so great that the SHIP or we call it as the SHIP as the improvement plan. We're just grateful to have it. As we go in that space, and I often tell working with community partners, especially with their mission and their drive to serve the community. A lot of them, love to do great work out there in serving the people. But of course, when it's great to have a blueprint, is what I consider it to be, and where direction in how we are helping the people and being able to serve. It's one thing to say, hey, we want to build a house. But of course, and this is how we want it to look. But of course, with the blueprint, we know what we are entitled to in the works of how we're going to start it and what we need to really focus on when it comes to building it. And so that's what the SHIP does, and it's so great that the improvement plan, and I like that Paul mentioned about the collaboration because it does consist of that and how we all are working together. Because, of course, when it comes to us as community partners, I always share with them, with working with them, is that, of course, we all cannot do it alone. We got to work together in those aspects of what we're doing. When it comes to that food insecurity, when it comes to transportation, things of that nature. So, of course, with all the work in which that we're doing, we just want to continue to, stay focused in those areas, as Paul mentioned, and making sure that, of course, that we now see where that blueprint is and what those numbers are looking at. So we always appreciative of the data that is provided, because not just because as it mentioned there, just Buford and Dillon, but this kind of is an eye opener just to kind of show the difference in just they're both in the same state, but this shows the difference in how the numbers just are so differentiated and just based on the location, the geographic location. So, that and we want to make sure that, of course, in the same situation that we're looking at that advance inequity, excuse me, inequity when it comes to those different those counties. So again, look forward to definitely taking a deeper dive into this and making sure that, of course, all of those who are interested is very much aware of this plan and how we can continue to move forward.
Thank you, Lamar. Councilman Shealy, I think Paul and I were just hoping at this point to just open it up to the group to get any thoughts about what's been shared, ideas for next year. Just open up the floor.
All right, very good. Any comments? Questions?
This is This is Morgan. I can kick us off. This is great work. Thanks for sharing this, Katie and Lamar and Paul for bringing it to the group. I do think taking a look at some of the more city and Charleston County data, whatever is available, could be helpful. It's nice to know kind of the priorities for the state, but then like Paul mentioned, Charleston County does tend to be on the better side of a lot of the indicators, but still some of the indicators are concerning. Even though we're better across the state, it's still a lot of people experiencing food insecurity or physically inactive, for example. But even within our county, I don't know if the data is available at this level. We see differences by neighborhood or zip code. So even, knowing what might be a priority area for downtown versus West Ashley versus Johns Island could also maybe be helpful for this committee. I'm not sure. That's one thought.
Morgan, I
Yeah.
think that's a great point. And, I'm not sure that it necessarily has been drilled down with this current data to that point, but some, what this showed is that we do need to pull from a lot of different sources. And so while maybe DPH has not looked at Charleston County or City of Charleston zip code data, we might, like the Low Country Food Bank might have data around affordable and nutritious foods, or Charleston Moves might have done surveys around safe and affordable places to be physically active. And DPH, obviously their priorities, but we can certainly request a deep dive into data. Probably not every piece of data here in the ship, but as we think about priorities, I think absolutely we can go back to the groups at Department of Public Health that pulled together a lot of this data and ask how specific they can get for the city of Charleston.
Councilman Shealy,
Yes, sir.
Katie, thank you so much for this. This is wonderful. It really is. I really like this. So just a couple of sort of quick comments, I guess, is that I think this work is incredible in terms of helping to identify where some of the priorities are, especially in the context where, let's be honest, resources are going to be constrained. I think we all wish we would have unlimited resources, but I think this helps us understand a bit more as to where are the priorities and where can we come together to apply the resources that we've got, which are always going to be in scarcity, to have the greatest impact. So I think this is really helpful in terms of providing the framework to be able to do that. I mean, the other comment I would say as well, and it's interesting that the way that Beaufort is pulled out there as well. And I will just say that from our own data, whilst Beaufort is presented here as, if you like, on the spectrum of being the better off, we are particularly concerned about Beaufort because in terms of the percentage increase in food insecurity in our 10 coastal county service area, Beaufort has the highest percentage increase in food insecurity, albeit in terms of absolute numbers are not as high as other counties, but that percentage increase is concerning. So what this also sort of helps, I think, as well, is not just look at what the situation is today, but what sort of trends are we seeing as we look into the future as well. We're seeing quite a lot of change in just using Beaufort as an example. We're seeing a lot is happening, evolving in Beaufort around, for example, issues of homelessness. And part of that is around the increase in the cost of housing and the increasing cost of rent as well, which is meaning that housing is becoming an increasing problem and a challenge, and related to that, therefore, is access to affordable food is increasingly becoming a concern. So therefore, whilst we can look at this from a position of it's not as bad as some of the other counties, what is it looking like as we think about the future? And I think that's the same sort of thing that we can think about here in Charleston, in the city of Charleston as well, is what are we seeing today which may be influencing what may be a picture for the future in the years ahead as well. So therefore, what do we need to be doing in terms of responding to that today in preparation for a future tomorrow?
I think those are great points, Nick, and I think that is analogous to what's happening in in some of the neighborhoods in Charleston, right, where affordable housing is becoming increasingly scarce. There's been a lot of talk, certainly in the city and the county of Charleston around affordable housing, but certainly I agree that as we look at percentage change, that's an important part as well as the numbers presented here.
Got something.
Lisa?
Yeah, I wanted to say that a lot of y'all know I work in beyond Charleston. I work in a lot of the rural communities. And I think when my coaches and I go out there to start a program, oftentimes we don't have the relationships that we need. We've got the monies, we don't have the relationships to get the people to the program. So I think, I know we're supposed to be focused mainly on Charleston, the city of Charleston, but Charleston County has Hollywood, Allendale. I mean, there's some rural areas even within, and especially within the Tri-County. I mean, Cross and Berkeley County. I mean, there's some rural areas where there are monies available, but we're not getting to the people that need it. So I don't know how we can build those relationships, maybe with the churches. I don't know, but I think if we can't get in, then we're not doing the good that we want to do. So building relationships, which I see down there as one of the community and development, neighborhood developments, I think that's really important because people today are just bombarded with so much information. But if you can build the relationship and they can get the information, they'll come. So that's my 2 cents worth.
I agree with that, Lisa, and I do think that that's some of that probably starts with collaboration with those trusted people in the communities and even with the group that's on this committee and Lamar and his community engagement team are certainly all about building relationships in the community. And so I think these changes are not going to happen without that aspect, which is huge for sure. Thanks.
Anyone else on this?
Uh,
Well, go ahead, Morgan.
Sorry, just one more comment, Paul. One more idea to maybe we could think about more in the new year. But I mean, I feel like the mayor's newsletter and communications have been strong this year that go out about the events and ongoing things in our city. I mean, we could consider planning and having some strategy where our wellness committee, is able to get into that newsletter. Maybe it's not every time, but once a quarter about an issue we're focusing on, or just I see this group a lot of times. What I do is go back and share information that I get with folks that I think are, need to hear that information or could benefit from that information. And so maybe we try to think about ways to continue to share the message from and the good work that's going on from the groups in this committee in different ways in 2026.
Yeah, I would add to that. Our neighborhood association's a pretty strong network, and I heard Lamar or somebody mention neighborhoods, and we really need to maybe put that's the charge for me is to maybe make sure we have a little bit better communication that's getting into those neighborhoods from my role to get into there. So I'll keep in focus on that as well.
Very good. Okay. Anyone else? Well, thank you, Dr. Richardson, for that very good report presentation, and Lamar, thank you for your information as well as and Paul as well. So thank you so much. Anybody else before we move on? All right. Well, we're still going to stay with Dr. Richardson, but we're going to get her to give us our community health update.
I'm not gonna make this as long as I usually do since I've already been talking a lot, but I want to shout out our World AIDS Day event, which happened on December the 1st. Thank you, Paul, for attending. We had a great turnout of community members, Tri-County SHAPE partners. It was at Mount Moriah Missionary Baptist Church. It was live streamed and is available to watch on Facebook by going to Tri-County SHAPE site. And it was just, it's a great reminder, not only of the people that have been lost over the last year and years past from HIV, but also of all the good work being done out there and all the strategies that are really in place to end the epidemic. If we again, as we've talked about, if we collaborate and work to reduce stigma and get the prevention strategies as well as the treatment to those in need. So I wanted to give a shout out to that. Wanted to talk a little bit about measles. Our case count in the upstate has jumped to 82 cases. So there's only 2 states in the nation with larger current outbreaks, and that's, I think, Utah and Arizona. Cases are still mostly in Spartanburg, with 2 cases in Greenville, might be a few more, but still in the Spartanburg, Greenville area. But 8 more schools now have students in quarantine. And what we're seeing is that most of those being diagnosed with measles are being exposed either through their schools or through churches. Only a few churches in that area. And we're certainly concerned, the Thanksgiving exposures we wouldn't have seen yet, given the incubation period. So we're certainly concerned that those cases will continue to rise, and with potential travel over the holidays, there is an increased risk then that measles will spread throughout the state. We've given about 44 doses of MMR vaccine through mobile health units, and we continue to put out press releases several times a week and have a web page with lots of information. Most of the cases we're seeing are in children still, although there can also be family members, including adults, that do then get infected because it's just so contagious. So that's sort of the state of the measles outbreak in South Carolina. On the respiratory virus front, we are starting to see some increases in flu cases. We have had our first flu death. If it's not been in the news, it will be soon. There were 39 hospitalizations last week. And again, with the Thanksgiving holiday, we are expecting those numbers to continue to rise. So for anyone who's not gotten their flu vaccine, there's no time like the present to go ahead and get that. Paul shared with me some recent news about potentially new flu vaccines on the horizon in phase 3 trials that may be even more effective. But the vaccines that we have certainly decrease often by as much as 50% flu-related hospitalizations, as well as outpatient visits for flu. We've seen small increases in RSV, or respiratory syncytial virus. There's also a vaccine for that. For certain age groups, so please ask your provider about that. COVID is currently staying pretty stable, but again, every previous year around the holidays, we have seen increases. So it's not showing up yet in our data, but certainly we may see it in the coming weeks. Lastly, I wanted to highlight one event. I've shared it with Paul. Lamar actually shared it with me. And so Paul will send it out, but it is on December the 20th from 10 a.m. to 1 p.m. at the Minor Crosby Community Center in Charleston. It's called Holiday Table of Hope. We'll be providing hot meals, grocery boxes, WIC services, and more, co-sponsored by Department of Public Health and other partners. So for those in need over the holidays, please help us to get the word out about that. Thanks so much for having me as always.
Thank you, Dr. Richardson. I couldn't get it off of mute there. Thank you so much. Appreciate that. Any questions for Dr. Richardson? Well, thank you again for that report. We'll move on to our community health and wellness updates. Anybody have anything? Nick, can we start with you on your updates with Low Country Food Bank?
No, absolutely. Thank you, Councilman Shealy. Yeah, so as I think I mentioned in the last meet time we met, obviously we were facing a significant challenge with the government shutdown. I think I'd reported that we were seeing quite a significant increase in the number of our neighbors seeking assistance. We were looking at a 3 times increase in the number of neighbors that were coming through our front doors here in the food bank looking for assistance. 90% of our partner agencies were experiencing an increase in the number of neighbors seeking assistance, as obviously we ran into the issue with the SNAP benefits not being paid out. And I think, as I said to you before, I think a lot of our neighbors don't wait until suddenly they don't have SNAP benefits. Many of them were preparing for that in advance and therefore looking at assistance and planning strategically for knowing that SNAP benefits would not be being paid. So again, that put a tremendous stress on the system, if you like. And I think, as I reported last time, we saw a tremendous outpouring of support and assistance. Many of our donors stepped up with additional funding resources, and of course our community at large did tremendous support with regards to food drive, fund drives. All of that to say that during the month of, and again, just to say that I think we were very thankful that got resolved. In the month of November, we distributed just over 4 million pounds of food. Our target for November had been just over around about 3.2 million pounds of food. So we were working flat out during November to get that additional 800,000 pounds of food out through our partner agencies and out into the community. That 4 million pounds of food that we distributed in November was in fact the largest amount of food we've distributed in a month this year. And obviously we're looking at that continuing as we go into this month of December, and obviously hoping that we can continue that, especially as the year comes to an end and we go into January. Just to say that we had another measure or metric, if you like, a significant outpouring of support from our volunteers. So in the month of November, we reached about 5,000 hours of volunteer time who were coming through and supporting the work that we do here at the food bank. Just to put that into perspective, that 5,000 hours of volunteer time in November represents roughly around 16 full-time equivalents. So that basically would mean that represents probably about a 20% increase on top of our staffing provided through volunteers. So again, despite the challenges and the problems that we faced in this last month, it was incredibly humbling to see what tremendous support we have from our community here in the Low Country, in Charleston, and across the different areas where we work. So really thankful for that, and thanks to everyone for all of your support in sort of sharing the information that Paul, I think you sent out in terms of where our neighbours can go to get food assistance, which of course will continue as we move forward both through December and into the new year as well. So I'll stop there.
Thank you, Nick. Incredible work and critical work. So thank you so much for all you do with the Low Country Food Bank. Thank you. Anyone else for health and wellness updates? Looking through to see if anybody has their hand raised.
I'm sure Jennifer has, Stacy wants to say something from mental
Yeah.
health. So
Okay.
Jennifer.
Yeah. Stacy?
Absolutely. Thank you, Councilmember Shealy. Jennifer, this morning is actually at day 2 of a homelessness sim, a strategic intercept mapping, where she and other members of the Tri-County are looking at homelessness in our region and where we can more strategically connect with folks experiencing homelessness so that we can pool our resources and work more efficiently. Mayor Cogswell was there yesterday afternoon. So this is the sort of the second part of that meeting. So hopefully next month, Jennifer will have some updates on that. That's really it for us. We will be in the City of Charleston Parade, Department of Mental Health will, and we look forward to seeing y'all there.
Great. Thank you so much, Stacy. Appreciate you being here and filling in and being with us this morning, and excited to see you in the parade Sunday too. So, all right. Anyone else? Anything else? Paul?
Kevin, if I could go back to, wasn't able to really participate with Maggie. He was talking about the minutes, but I tried that as an experiment. I used GPT to help me with them. And I really wanted to get, before we approved them, I really wanted to just see how people liked them, because I try to always cover the questions at least, but we do record these things, so there's much better information. But, you can't get everything perfect on it. And so I almost want to hold off on those minute approvals till we've had a little more chance to look at them and see if we can improve them a little bit better. Because I think it's important to make sure questions are answered and that they're listed. Sometimes they're skipped over when we do a quick summary like that. But and I appreciate your helping me correct some of those other little things that we just don't catch when we do a recording on it all. But I just want to see if y'all like that format or if I need to get a little more deeper into it. So that's what I was really looking for input on today.
Well, thank you for all your work on that, Paul. Appreciate all that you do to make this stuff happen. So thank you. All right. Anybody else? Anything else to come before us? Well, thank y'all so much. I appreciate everybody being here. I know December is a crazy, hectic time sometimes, so I appreciate everybody taking the time this morning. I know your time's valuable, and it's valuable to us as well. So thank you so much for making the city of Charleston healthier. And if there's nothing else, we stand adjourned. Thank you so much.
Thanks, everyone. Happy holidays.
Happy holidays.
Happy holidays. Kevin, if you'll just hit stop record. And then, or hit leave meeting, and then I'll call you and talk to you after this.
Okay, very good. Let's end.